42 relating to health insurance exchanges. And before we get to taking testimony, most of you probably noticed that we have some folks here wearing a pink swatch, they asked me if I would briefly explain that. I'm happy to do that. Those who are wearing pink want us to know that they are opposing a health care exchange, and I want to thank you for finding a way to express that to us in a respectful way and in a way that's not at all disruptive, so we appreciate that very much. So this is how we're going to proceed with the balance of this hearing. And again, we have a hard break off at 3 o'clock. If we're in the middle of debate on a motion, we'll go until that's resolved. But we'll take testimony from now until about 2:40. We are going to impose a 3-minute limit. We want to hear from as many people as possible. I've already had some inquiries. Can I yield my time to somebody else so they can take 6 or 9 minutes? And we want to hear from as many folks as we can, so we're not going to have that. Now, if you want to give your time to somebody else and let them take 3 minutes, that's fine, but we won't allow multiple people to yield their time to someone else. We're going to, after we've taken testimony from the public, we'll allow Mr. Hensley the opportunity, as the sponsor of the bill, to make some closing comments, and then the committee will have the balance of the time to consider the legislation. Now, when taking testimony, we know we had lots of people that were here early and signed up, so we're going to take those that were here first and give you the opportunity. The Vice Chairman, Senator Patrick, has got a list for us of who will be testifying in what order. We're going to alternate pro and con so that we hear from one that's for and then one that's opposed. Now, since we likely have some folks here today who weren't here Tuesday, I want to review just some basics about testifying. We'll have Senator Patrick call 4 names, and we've got 4 seats up here reserved right next to Ms. Bishop right here. So if when we call that group of 4, if you'd come take your seats in that row, and then we'll call you up individually. When it's your turn to testify, please step to the podium. Make sure the microphone's in front of your mouth, close enough that we can all hear what you have to say. We want to make sure that if you're going to take the time to come speak to us, that we have the opportunity to hear clearly what you're saying. State your name, and if the spelling isn't obvious, please spell your names for the secretary so she can get it correct. Tell us who you represent. If you're representing only yourself, that's fine. Just tell us that. And then tell us what you have to say and remain at the microphone. We'll see if we have questions from the committee. Now, if you have written testimony with you that's either what you've said at the podium or maybe extended remarks, you can leave those in the basket. Maybe we don't have a basket. Leave them here on the desk. Okay, we have a basket there. Leave your testimony there. Now, if you came today with written testimony and you don't have the opportunity to testify, we'll invite you after the meeting to leave your testimony in that basket as well, and we'll make that a part of the record. Don't worry if you're a little nervous. That's not a problem. We'll be patient. One or two other things. As I mentioned Tuesday, this issue has the potential to generate a lot of emotion. And that's not a bad thing, but we do need to be respectful, and I appreciate the fact that we had a respectful group so far today and last Tuesday as well. Most people in this room are going to agree with every other person that speaks and disagree with the others, right? And we're all going to experience some of that. Please show respect to everyone who's speaking. And to help with that, we have some rules about behavior in committee meetings. I'm going to ask you to please refrain from any expressions of support or opposition. So that means no applauding, no cheering, no booing, that sort of thing. We see the pink splotches, and we know what that means. So with that, Mr. Senator Patrick, would you like to tell us who the first 4 that we're going to hear from are, please?
Thank you, Mr. Chairman. And I hope, I apologize up front if I mispronounce these names, but I'll do the best I can. First of all, we have Peggy Munson, Tom Munns, Jenny Randone, and Terry Yon. And you can correct the name when you get up here.
All right, so we'll ask Peggy Munson to step to the podium first then. And again, just introduce yourself, Peggy, and tell us who you're representing.
I certainly will.
And let me just mention one other thing. We do have the timer here, so the page will start the timer when you start speaking. So it'll have a green light for the first 2 minutes. It'll turn yellow when 2 minutes have passed, and it'll turn red when the 3 minutes are up. So we're not expecting you to stop in the middle of a sentence, but just wrap up very quickly once you see the red light, please.
Absolutely.
Thank you.
Good afternoon, Mr. Chairman and members of the committee. My name is Peggy Munson, and I'm a retired geriatric nurse, and I currently serve as the AARP State Volunteer President. Thank you for the opportunity to offer our perspective on this important public matter. AARP is a nonprofit, nonpartisan organization representing 178,000 members, age 50 plus, across Idaho, and I speak in support of Senate Bill 1042. Given the nature of the choices we are faced with, it is important for us to establish a set of facts that we can all agree on. The facts are, on March the 23rd, in 2010, President Obama signed into law the Affordable Care Act. That is a fact. That same day, Idaho joined 13 other states and filed suit to challenge the constitutionality of the ACA. That is a fact. In June of 2012, the United States Supreme Court upheld the constitutionality of the ACA. That is a fact. Most of the discussion on Tuesday centered around the approach of just saying no or delaying action. These are not choices we have. Please make no mistake, whether Idaho chooses a state-based health exchange or defaults to a federal exchange, the fact of the matter is there will be a health exchange in Idaho whether we like it or not. Therefore, we respectfully urge your support of this bill so that Idaho can have the opportunity to take responsibility and control for its own insurance marketplace. Governor Otter has shown tremendous leadership throughout this process, and he has defended Idaho's sovereignty at every turn. But the governor recognizes that given the lack of options, the path forward that is in the best interest of all Idahoans is to adopt an Idaho-based health exchange. Idaho is a poor state. We are an aging state, and we have 278,800 Idahoans are without health insurance today. And who are these Idahoans? They're hardworking people, many of whom have children, and for a variety of reasons they cannot afford health insurance. But they have medical needs, and these needs are not going away. For instance, a 58-year-old man who is laid off from his job isn't old enough for Medicare, he doesn't qualify for Medicaid, or have access to employer-provided health insurance. He would qualify for a tax credit that would allow him to purchase quality, affordable health insurance, and this is a good thing. The time to act is now. A state-based exchange managed by Idahoans for Idahoans is the best path forward. And I thank you, and I will stand for questions.
Thank you very much, Ms. Munson. Are there questions from the committee? Apparently not. Thank you very much. Appreciate your testimony. We'll now hear from Mr. Tom Munns. Welcome back to the committee, Mr. Munns. We had the opportunity to visit a little bit after the last committee meeting. It was my pleasure to
appreciate that.
A little better.
Greetings, Mr. Chairman and committee members. My name is Tom Munns from Caldwell, Idaho. I'm representing the Constitutional Republic of the State of Idaho. As Americans, it's our duty to challenge government authority whenever necessary, as a means to remain vigilant, preserving freedom for our posterity. But with the constant increasing barrage of assaults on our personal liberties, and a few standing against this assault, I stand before you with the respect I once had that's actually given way to a genuine concern. My concern is a continual encroachment on the rights of the people, specifically but not limited to the federal government's assault on the states, and the forceful submission to blind mandates and a variety of unknowns by a government that lacks the right, the authority, and the jurisdiction. As I attended the healthcare debate weeks ago, it was mentioned several times that we have a socialized system. If those in support of this system state that this is the truth, and the Supreme Court charged with guaranteeing our constitutional Republican form of government also supports this system, does this not only violate their oath supporting a foreign form of government, but prove that the Supreme Court, rather than protecting and upholding the Constitution, has been in fact hijacked, and that they are nothing more than 9 tyrants or 9 King Georges in black robes, not protecting the rights, but now telling us what they are? How is this consistent with the principles of freedom established by our forefathers? This healthcare issue should not be about how many people are without healthcare or how many people support this monstrosity, because we are not a democracy. This should be about whether the feds or the Supreme Court are within their jurisdiction and within their delegated powers to be able to force the states and the people to mandates when it is not only out of the jurisdiction of both, but contrary to a free, sovereign, and independent states and the people. If we are still a constitutional republic, which I'm gathering that we're not, and government's job is to preserve and not restrict the rights of the people and the states, how is this healthcare exchange consistent with these principles when we are all forced to allow every branch and political subdivision to be able to operate outside of their limitations by imposing mandates and unknowns on the people that swore to serve and protect the people? The simple fact that our state would even consider a monster like this scares me, because it leaves me questioning not only integrity and the knowledge of our state government, but the backbone when it comes to protecting the people they represent. If the people truly prefer a form of government foreign to our Constitution, then they do so at their own ignorance. But if we still honor this document and the freedom it secures, the only way a system of health care should even be adopted is by a proper constitutional amendment process where the people are fully aware of its ramifications, and not by a blind legislative enactment that will subject them to random, ever-changing, and hidden variables. We, the people, need to demand adherence to the written law, created for our protection, that limit government, not forcing us to bow to their wishes. In case you can't tell, I not only oppose the state exchange, but oppose it with all of my being, not because I'm insensitive to the needs of others, but because it's purely unlawful. Thank you.
Thank you very much, Mr. Munns. Are
Any
there
questions?
for Mr.
No.
Munns? Apparently not. Thank you very much, though. Next, we'll hear from Jean Brandon. Hope I said that right. Apparently not, so you'll correct me, I'm hoping.
Thank you, Mr. Chairman. My name is Jean Brandoni, and I represent eHealth App today. eHealth App is an Idaho-based company providing online health insurance application and enrollment software used by small businesses and individuals here in Idaho. I'm here to speak on behalf of Idaho small business owners, Idaho insurance brokers, and I speak to you today as someone who has been involved in health insurance exchanges for the past 2 years. Let me tell you a little bit about how Idaho individual and small business health insurance runs right now. Over 2,000 Idaho small businesses and over 40,000 Idahoans throughout the state, including all of your districts, utilize the software of eHealth App through their chosen health insurance agent to safely, securely, and inexpensively find health insurance coverage. Now, for the past 2 years, eHealth App has also been the exclusive front end of the Utah-based health insurance exchange now named Avenue H. Small businesses in Utah have the ability to seamlessly gather quotes from both the traditional market carriers and the exchange, utilizing a single cost-efficient application process through eHealth App software. So at eHealth App, when we speak about exchanges, we respectfully speak with experience. As an Idaho-based small business in a very competitive industry, eHealth App needs to offer health insurance in order to keep our own employees covered and to remain competitive in the marketplace. Today, like thousands of other small groups in Idaho, eHealth App employees complete our applications online. We send them to multiple carriers and then work with our health insurance agent to evaluate our options and make our selection for another year. And in Utah, it's very similar. Small groups using our software can submit their applications not only to multiple carriers, but also to Avenue H, the exchange, allowing them to get quotes both inside and outside of the exchange, simply by clicking a button in eHealth App. A properly designed state-based exchange would allow Idaho businesses to manage their quoting and enrollment process as efficiently as possible. If Idaho does nothing, if Idaho does nothing or outright chooses or defaults to a federally run exchange, Idaho individuals and small businesses will have the burden of managing 2 disjointed quoting processes, and that is something to think about. Small business owners would have to review the options offered up by a federal exchange despite their personal or political affiliations, because they wouldn't want to potentially handicap their company by not reviewing all of the options. So imagine how difficult and time-consuming that this will be for Idaho small businesses and individuals, as well as how difficult and time-consuming for health insurance brokers. A vote for a state-run exchange is a vote to reduce the complexity of shopping for health insurance, saving our residents time and money. It ensures that Idaho businesses can compete with other businesses in other states on a level playing field, and it gives our Idahoan insurance brokers a fighting chance to maintain current best practices and ensures Idahoans that they will be able to continue to do so. Over 40,000 Idahoans already enjoy the benefits of a single online health insurance portal built and supported by Idahoans.
Ms. Brandoni,
A vote for a state-run exchange is the right decision for Idahoans, health insurance brokers, and small businesses.
Thank you.
Thank you, Chairman.
Let's see
and
if we have
committee.
questions. Questions from the committee? Apparently not. Thank you very much.
Thank you.
We'll next hear from Terry Vaughn. Come up and tell us how we say the name appropriately. Sorry.
Thank you, Chairman. I've lived with that all my life. Yawn.
Yawn?
As in John.
Okay, thank you.
Gentlemen, thank you,
Can you
Chairman.
spell
Thank
that
you.
for us, please, Mr.
Y-O-H-N.
Okay, thank you very much.
This will be brief. I've heard, is it pro-federal, is it pro-state? And we've heard the other non-option by some, option by others, which other 26 other states have chosen, which is do nothing. Well, we know to do nothing means we have to do something. Has, in fact, our Congress, have they looked at what the other states, what they based this will do nothing decision on? I have no information on that. Have you been in contact? And I understand this is testify, not question, but has there been contact with other states? You know, wise man seeks counsel. And I guess I have to say, well, wait a second, maybe there is alternatives out there that we know nothing about. You know, what direction are they going? Why are they going there? How they're going to go there? I mean, you know, half of the United States of America has said nothing. Well, there's got to be something behind that. And I'm not the only concerned citizen that would like to have a little more information. And I just respectfully ask that you could look into it and give us that information. We'd like to make more of an educated choice of our own.
Thank you very much,
Thank you
Mr.
very
Young.
much.
Are there questions from the committee? Apparently not. Thank you very much. We'll have Senator Patrick now tell us who we'll be hearing from next.
Okay, the next four, we start with Scott Laval, Joseph Roner III, Bill Johnson, and Rod Beck.
All right, so we'd ask Mr. Laval to step to the podium. Thank you, sir. Introduce yourself.
Chairman, actually Scott Levitt, L-E-A-V-I-T-T. I represent the Idaho Association of Health Underwriters and also NAIFA Idaho, which is the National Association of Insurance and Financial Advisors. We represent over 1,000 health insurance agents and producers across the state of Idaho. We stand in support of a state-based exchange. And the reason why we stand in support of a state-based exchange is we have no other option. It's not the issue whether we have an exchange or we don't have an exchange. An exchange will happen in the state of Idaho. The best option that we feel is to have a state-based exchange. Otherwise, we default to a federal exchange. And here's some of the reasons why. If we end up having a state-based exchange in the state of Idaho, Idahoans will have more affordable choices and more plan options to purchase their private health insurance. It will also give Idaho small businesses the ability to control their health insurance costs more effectively. It will also give Idaho employers the ability to pick plans that best meet the individual needs of their employees instead of a one-size-fits-all federal government plan. It will also allow Idahoans to qualify for premium assistance in purchasing their health insurance choices through subsidies they can get inside of a state-based exchange. If we default to a federal exchange, Idaho will lose control. The federal government will come in and take over the control of the Idaho insurance marketplace. A federal exchange will limit the access to what products and services Idaho citizens can actually purchase. If we'll have the use of Idaho carriers and even the use of Idaho health insurance agents. People may be limited to call a 1-800 toll-free number and be put on hold to be able to deal with somebody in another state. Not somebody that can actually sit down and actually help them with their specific needs. They're also saying that if we have a federal exchange, usually a federal exchange will probably pick federal companies over state-based companies that know the Idaho marketplace. A federal exchange will also cost more money for Idahoans. Not only will it actually put business owners out of business, insurance companies out of business, and brokers out of business, it will cost more money. The 3.5% tax on a federal exchange will actually cost more money, by an estimated $21 million more for Idaho than a state-based exchange will actually cost. In addition to that, we run the risk of losing the premium tax, which I understand is the third largest revenue source for the state of Idaho. If we lose a premium tax going into the state coffers, that money will be diverted into the federal government's hands to be able to help run a federally facilitated exchange. We also will lose a regulatory control. We have a Department of Insurance here in the state of Idaho that regulates the rules that are put in force that you guys actually pass here. That will be taken out of their hands and be run now by the federal government. So once again, we ask for your support for a state-based exchange, not only for the citizens of Idaho, for our industry, because once again, we cannot sit around and do nothing because there's a double negative in this law. And the double negative is basically this, that if we do nothing, we get the worst result, which is a federally run exchange. Chairman, I stand for questions.
Thank you. Questions for Mr. Levitt?
Mr. Chairman.
Senator Getty.
Thank you, Mr. Chairman. Mr. Levitt, we've heard at least once, and I've had several emails about a private free market exchange. You're in the business, so tell me if it's your understanding if something like that were adopted, whether any of the premium subsidies that would be available in either a federal or state exchange would apply.
Mr. Levitt.
Yes, Chairman and Senator Getty. I do not have the answer on the details of that yet because I know right now the options at hand are either a default federal exchange, a partnership exchange, or a state-based exchange. But the details of that, I do not know the answers to that. I apologize.
Thank you.
Further questions for Mr. Levitt? Thank you, Mr. Levitt.
Thank you.
Appreciate your testimony. Mr. Rohner, please.
Mr. Chairman, members of the committee, my name is Joe Rohner. I speak today on my own behalf and that of my family, friends, and fellow travelers.
Thank you.
I am a free market capitalist in every sense of the term. I speak against the measure and urge that it die in this committee. I am deeply disappointed that Obamacare is being championed by none other than Governor Butch Otter, one who has always held himself out to be a supporter of individual liberty and economic freedom. From this day forth, Mr. Otter owns Obamacare, which shall be known statewide as OtterCare. I have emailed 3 documents to all members of both bodies of the legislature relative to the measures under consideration. I printed copies for each member of the committee, and I would ask that the clerk distribute them with permission of the chair. And
We'll have the
right
page
here.
distribute those, sure.
I'm sorry, sir?
We'll have the page distribute those.
Thank you, Mr. Chairman. The documents are, number 1, Obamacare, A Deception, published by Dr. Paul Craig Roberts, an Assistant Secretary of the Treasury under Ronald Reagan, with written introduction. The article was written anonymously because the author feared reprisals. Dr. Paul Craig Roberts is a highly respected individual in economics and finance and is well known. This article is a must-read. The second one, 20 Hidden Tax Hikes in Obamacare by Grover Norquist. The third, IRS Cheapest Obamacare Plan will be $20,000 per family, published on CNS News, founded by L. Brent Bozell. Since I've only got 3 minutes, I'll briefly describe the contents of each. Dr. Roberts nails it in his introduction. The age-old rule, follow the money, applies here. He exposes Obamacare as a complete fraud on the face of it, as well as in the details of it. Dr. Roberts points out that what was sold as a panacea of low-cost health care for the entire country is, in fact, a massive transfer of wealth to the insurance companies, which delivers little health care to far fewer people. In fact, Obamacare will cover the fewest number of people at the highest possible cost. Worst of all, Obamacare will completely destroy the national economy unless the dollar collapses first, which is a very high probability. The article fleshes out the details. Please read it thoroughly. The second detailing of possibly countless hidden tax hikes in Obamacare speak for themselves. I shudder to think what else Obamacare has done for the people of America that we do not yet know. The third is a report with IRS data showing how Obamacare will cost a family of five $20,000 per year. The rush to judgment to implement the state health care exchange by the governor is, in my opinion, totally disingenuous. While half the states fight valiantly on to defeat Obamacare, Mr. Otter prepares to hand total control of big health over to big government and big insurance. These conditions
Mr. Owner, can you wrap up quickly, please?
Are defined by Thomas Sowell as fascism. I'll stand for questions, sir.
Are there questions for Mr. Owner? Thank you, Mr. Owner.
Thank you.
Appreciate you being here today. Mr. Bill Johnson, did we get the name right? Apparently not. If Mr. Johnson isn't here, Mr. Beck, Rod Beck. Welcome, Mr.
Mr.
Beck.
Chairman, members of the committee, it's a pleasure to be here in front of you today. My name is Rod Beck. I live in Boise. I speak to you today as a former member of the body, the Senate. I speak to you today as a former chairman of a portion of this committee. And I speak to you today as a former majority leader of the Senate. I have a deep and an abiding respect for the institution of the Senate and the institution of the legislature. It's a co-equal branch of government, and it's that co-equal branch of government that has distinct constitutional functions. As a co-equal branch of government, we are to legislate, appropriate, and provide oversight. That's the check that we have on the other branches of government, and that's the beauty of our system. And it's for that reason I have such a deep and abiding respect for the republic that we have established. It's also the very reason why I'm opposing Senate Bill 1042. If you look at it, it creates, and you know this, so I may be a little redundant, but it creates an independent body, corporate and politic. Well, think about that question, independent. It's independent from you. You have no further oversight. You've lost your ability to appropriate. You've lost your ability to regulate. A big portion of the first 2 or 3 weeks of a legislative session is in overseeing the regulations that's been promulgated by various agencies. You don't get to do that with this. And this is going to impact, as the sponsors have suggested, 278,000 people. I would suggest that's probably a conservative estimate. That's about 8,000 per legislative district that will have no oversight from the legislature because you've granted them unilateral capability to set up their own regulations. Additionally, there's a cost associated with that, and that cost is still somewhat unknown. The sponsors suggested it's $20 million. Last fall, the task force that the governor set up was told that it could be as high as $70 or $77 million. So we really don't know what the cost of establishing it is. Now, the sponsors suggest that the ongoing operation would be $4.80 a month, I believe, per participant. However, this legislation grants them unlimited taxing authority. Unlimited. You don't regulate that at all in this legislation. And so I would ask you, preserve your capability as granted you under the Constitution. Do not grant an independent body, corporate and politic, unlimited taxing powers and unlimited regulatory powers, Mr. Chairman.
Thank you, Mr. Beck. Questions for Mr. Beck? Senator Getty.
Mr. Chairman, thank you. Mr. Beck, it sounds like you're concerned about how the governing body is set up. If the governing body was set up with more legislative oversight, would you favor a state exchange?
Mr. Beck.
I would be similar to how the state of Utah just proceeded. I have no problem at all setting up a marketplace like one of your previous testifiers suggested, where a person could go on and do a universal application. I'd have no problem with that at all. And that's what the state of Utah started a couple of years ago, where you could go. In fact, I would think that you could even expand that universal application, if you will. And if there's a company in Stamford, Connecticut that would provide the type of insurance that I would appreciate, that I could actually buy it at a universal application process. The governor of Utah just yesterday tried to find a seat at the table, and he found out there wasn't even a table. Kathleen Sebelius essentially kicked him out of his office, and they announced, we're not going to do a state exchange in the state of Idaho. They're going to continue their universal application process, but they're not going to do the other portions as dictated by the federal government. So yes, I would support the universal application and things like that. I have no problem with that. In fact, I think it's a good idea. But I wouldn't support the portions that for the reasons that the governor of the state of Utah said no to the federal exchange.
Follow up, Senator
Mr.
Gage.
Chairman, Mr. Beck, I don't think you answered my question.
Yeah, I did.
So did you support a state-based exchange or not?
I would support
Mr.
a state-based
Beck.
exchange just like they had in Utah, and I would also support the governor's position to not go forward with the approval to allow them to do all those to require that they do all those other things that a state-based exchange would be required to do.
Thank you.
Senator Durst.
Mr. Chairman, Mr. Beck, as I've expressed to you privately, I have some serious concerns about the legislative oversight in this legislation. I think it's basically non-existent. I have serious problems with that, but I'm wondering if you have any
So
suggestions.
you agree with me? It's nice.
Mr. Beck, would you please go through the chair? Let's let Senator.
Mr. Chairman, thank you. Mr.
Go
Beck,
ahead.
my question is, what should we be doing differently then? If you had drafted this legislation, what would you have put in here to make it different, notwithstanding the questions that Senator Getty just asked, but simply on the question of oversight, what would you have done differently?
Mr. Beck.
I do not believe that this, Mr. Chairman,
Thank you.
I do not believe that this legislature should ever give up its oversight responsibility, ever under any circumstance. And so, in order to receive my vote, it would require very strict and strenuous oversight. Now, I wouldn't want even to have a state exchange unless I knew exactly what the state was getting into, unless I knew exactly what our responsibilities were going to be. I wouldn't want that to occur.
Further questions for Mr. Beck? Thank you very much.
Thank you, Mr. Chairman.
Senator Patrick will tell us who we'll hear from next.
Thank you, Mr. Chairman. We'll have Steve Thomas, Tony Sinsko, Tom Shores, and Stephen Ackerman.
Thank you, Mr. Thomas. If you'd step to the podium, please. Mr. Thomas, go ahead.
Mr. Chairman, thank you. Steve Thomas for the Idaho Association of Health Plans, here to speak in favor of Senate 1042. I'd like to make three basic points, if I might. Number one, let's keep it simple. 1042 isn't that hard. Idaho can do this more efficiently and less expensively than the federal government. Even Mr. Hoffman conceded that in his testimony Tuesday. Meanwhile, 1042 keeps millions of dollars in Idaho and in our citizens' pockets, while also maximizing local control. Point two, a word about the opposition. I was here on Tuesday and listened, and I would say the opposition is sincere, yes. It is patriotic, yes. And it is angry, yes, very, very angry. But I submit with all due respect that the opposition answers the wrong question. The opponents who testified Tuesday detest Obamacare and the substantive decisions that law made to the insurance industry, including in particular the mandate to buy insurance. The mandate seen as impairing their personal liberty. Yet 1042 does not address those market reforms to the insurance product. It expressly does not mandate that any Idahoan use or not use the exchange. Rather, 1042 addresses how to deliver the product to his customers. It's a bill about process. And the process chosen, an exchange, is a market-based concept, a concept that goes back, ironically, to the Heritage Foundation on October 5, 2006, when it proposed a state-based health insurance exchange. True, not identical to the PUPACA exchange, but substantially similar in concepts. And of course, an exchange goes back even further than October 2006. Witness May 1792, when the Buttonwood Agreement was formed at 68 Wall Street. It's now known as the New York Stock Exchange. So an exchange is an old idea and a good idea, quintessentially a market idea. Third, the heart of the opposition leads us to 4 key words: law of the land. I use slightly different 4 words: the rule of law. But it is one and the same idea. In 1803, the U.S. Supreme Court decided Marbury versus Madison, holding that it was the court's job to say what the law is, not the president's job and not Congress's job. Is that 2 minutes or 3 minutes, Mr. Chairman?
That's 3 minutes, Mr. Thomas, if you'd wrap up quickly.
Thank you. My point is simply this. The court has spoken, and the rule of law needs to be followed, and I would be happy to stand for questions.
Thank you very much, Mr. Thomas. Are there questions for Mr. Thomas? Thank you. You bet. We'll next hear from Tony Sneckel, and I probably really murdered that last name. I apologize.
Yes.
Help us out.
Yes, you did. Good afternoon, Chairman Tibbetts and senators. My name is Tony Snesko, S-N-E-S-K-O, and I'm from Hidden Springs. I'm here representing myself and my wife, Valerie. I believe I speak for most of my fellow veterans who have fought and many who died for our freedom. One of our many freedoms that we fought for, one of our many rights, is in jeopardy today. Liberty. Liberty. We firmly believe that Obamacare and Governor Ottercare would go bankrupt if they didn't have the power to increasingly raise fees and tax Idaho citizens and businesses to keep it afloat. Please don't burden our citizens with its predicted skyrocketing and oppressive costs that will most certainly force them to become indentured servants to either the state exchange, or the federal health care systems. This exchange, this pig in a poke that is before us today, reminds me of Nancy Pelosi's infamous quote, "We have to pass the bill so that we can find out what is in it." We don't know the cost that is in this. We don't know, because not even the federal government fully comprehends what is in it. We do know that when the camel, the federal government, gets its nose under our tent, his entire body will follow. And we will never get their socialist program out of our tent and out of our state. That will be your legacy if you approve the health care exchange. There are better solutions, and one of them is proposed by Dr. Lowell Fenwick, of which I have copies here. The Patient Power Plan eliminates government, insurance control, and overhead for most consumers. It will reduce unnecessary health care and consumption costs and return insurance to its proper role of protecting against catastrophic events. I want to tell you about my best friend of 38 years, who was considered to be the Will Rogers of Congress because of his humility, his humor, and his honesty. He was respected on both sides of the aisle because his moral compass and values never wavered and was never compromised by his vote. His steadfast commitment to doing what was best for America kept his approval rate at 70% and higher. I was the event coordinator for Congressman Duncan Hunter in Washington, D.C., and frequently I heard complaints from lobbyists about how they had given him large donations, but he voted against their funding. Duncan always believed that most people donated to his campaign because of his patriotism, his unwavering values, and his faithfulness to his constituents. Duncan drove an old American-made Suburban. His walk was similar to John Wayne's, and when he spoke, people listened. He was probably the best chairman the Armed Services Committee ever had, and because his leadership and decision-making process was fair and respected by all, and when he voted, he never thought about people who tried to buy his vote, only thought about the people, the voters he represented. And I would challenge you to do that, to think about the people that died for this country, for their freedom.
Thank you, Mr. Snesko.
Thank you.
Appreciate that.
May I make a request, Chairman, that a voice vote not be taken, that we actually know who votes up and down on this, and also if it goes to the chambers?
Sir, the committee will take care of that. And
Thank you very
decide
much.
the way we vote at the time.
Thank you.
Are there questions for Mr. Snesko? Very good. Thank you very much. We'll next hear from Mr. Tom Shores.
Mr. Chairman, members of the committee, thank you very much for letting me address you today. I represent first myself as a citizen of Idaho, a father and a grandfather, and I indicate those because I've learned over the years that sometimes the loudest opinion that's being expressed is not necessarily the best one. I'm also an insurance agent. I'm the president of Health Underwriters for the state of Idaho, and I've also been asked to represent the independent insurance agents and brokers of the state of Idaho also. I also had a chance to serve on the exchange board with Senator Getty and others and had a great experience there. I'd like to address a few of the pros and cons affecting the information we're dealing today with Senate Bill 1042. First of all, I'd like to talk about independent organizations. There are several of those that are functioning in the state of Idaho right now working very well. The one I'm most familiar with is the high-risk pool, so I'd like to address those. Some of you are old enough to remember that wasn't that many years ago that the government passed an overreaching bill called HIPAA, which changed our lives substantially. In that bill, there are a number of aspects which we're not going to have time to cover, but one of the things it required is that every state would have a health insurance policy that anyone could purchase regardless of their health. The state of Idaho got together with Idahoans and Idahoans working together with the legislature and the governor and created what is referred to today as the high-risk pool. My last count, over 30 states are trying to duplicate what we've done. Again, an overreaching government forcing us to do something, but with Idahoans working with Idahoans, we may have been a much better solution. And that has forced us to change a lot of things also. Second of all, some have recommended that we do civil disobedience, and I think it's been very, very well presented today that this is the law of the land, is something that we will need to work with. Many have asked the question about other options. Some of the options are incredible, but many of them are 3 years late or 3 years early, depending on how you look at it. One of the questions from Senator Getty was about a private exchange. The answer to that question is that if an individual were to set up a private exchange, they would be subject to setting up their private exchange funding and paying for that, as well as all the rules and regulations related to Obamacare and the penalties for not being involved. The next one is the governor's office has already summed up very well the cost, much less expensive for a state of Idaho plan. And some of them have indicated that we shouldn't do anything because of the rules situation. Well, my experience is in starting a business, going to college, starting a relationship. Most of us have very little information about what we should do in the next step, but we took off and did it anyway. I have a friend that related an experience to me the other day. He said he has a friend of hers that she will not leave the house until all the lights are green between her house and the destination where she's going. Obviously, she doesn't leave the house very frequently. We have to do the same thing. We have to move forward with the information we have and make adjustments as necessary. I think working with the exchange gives us the opportunity on a state basis to be able to do and accomplish what we need to do. And as an organization of health insurance agents, we're positive, proactively going after it. We're working with a number of organizations to put ourselves in a position that we can help individuals in a great way to make that occur. I'm finished with 7 seconds.
Thank you very much, Mr. Shores. Are there questions for Mr. Shores? Apparently not.
Chairman.
Oh, excuse me, Senator Getty.
Mr. Chairman, Mr. Shores, I want to explore the private exchange maybe one more step. Is it your understanding that if a private exchange were established and we did not establish a state-based exchange, that we would then be subject to the federal exchange?
Mr. Shores.
Mr. Chairman, Senator Getty, the answer to the question is we will have a federal or state-based exchange January 1st, regardless of what anyone else does. if an organization or the state or a company decides to set up a private exchange, they would still be subject to the laws of the federal exchange if that's what we chose to do. Which means if I'm a business and I have over 50 employees, I would be responsible for paying a penalty of $22,000 per employee per year for those expenses, plus a bunch of other things. So the answer to the session, that is not a solution. It's just hopefully a better way.
Follow-up, Senator Getty, please.
Thank you, Mr. Chairman. Mr. Shores, would the premium subsidies that would be available in a federal exchange be available to a private exchange?
Mr. Shores.
Mr. Chairman and Senator Getty, as I understand it, the answer is no.
Thank you.
Further questions for Mr. Shores? Thank you, sir.
Thanks.
Appreciate it very much. We'll next hear from Stephen Ackerman.
My name is Stephen Ackerman, and I represent myself. Good afternoon, Mr. Chairman, members of the committee. I rise today to explain why I recommend the committee not support Senate Bill 1042. The first problem is that the state exchange is not a made-in-Idaho solution. The benefits offered, the coverage levels that are set, and the rating system that helps determine the premium are all based on federal rules. Control over the governance doesn't really matter when federal rules are controlling the buying and selling of insurance. The true operations or guts of the exchange. The second, and this is one reason why 25 states have decided not to go forward with a state exchange. And I note that they're not concerned over their sovereignty in doing that. The second is a bit of read out of Section 1311 of the Affordable Care Act. A state exchange may not, and this is a quote, may not establish rules that conflict with or prevent the application of regulations by the promulgated by the Secretary of Health and Human Services. Notice that a state legislature cannot override a federal regulatory agency in this case. So I believe there's a loss of power in the legislature. The second problem is that the scope of benefits are not clearly defined. The 10 essential health benefits that are laid out in the Affordable Care Act are clear, but these are categories. It is the scope of the benefits that matter. And this brings great concern to me in terms of the effect on premiums and the effect on costs. The argument that these benefits are already offered by insurance carriers does not matter. It is the scope of the benefits. I would argue that common sense tells us if you don't know the scope of a program, you cannot budget it. Third, the uncertain and shifting costs with a state exchange. The user fee for the state exchange has gone from $3 per member per month to $7 per member per month, and now we're hearing $4.80 per member per month. I am not comfortable that over the last 90 days, we have seen the operational costs increase by 134%, then decrease by 31.4%, and end up 60% higher than their original estimate. Does the $4.80 per member per month assume all 177,000 people will enroll in this voluntary program? And remember, it's a voluntary program. If not, the cost of the state exchange will be higher. Could it be higher than a federal exchange? We don't know. Saying no to a state exchange is not a do-nothing strategy. If we say no to a state exchange, the federal exchange cannot enforce the tax mandate on businesses and citizens. The Supreme Court was clear. Congress may tax people who don't buy qualified health plans, specifically qualified health plans. However, the court did not say the process in which that must happen. To look for the process, you must go back to the law. And the law is clear. And I'll just finish right here, and I'll be happy to take any questions. The law is clear that only a state exchange can enforce tax subsidies, credits, and yes, tax penalties.
Thank you, Mr. Ackerman. Questions?
Questions?
Apparently not. Thank you very much.
Thank you. And I have some counter arguments that I'll leave with the committee from Blue Cross of Idaho, who have made some statements lobbying in favor of it, also the Health Exchange Alliance, and finally, an amended complaint by the state of Oklahoma, which is basing its complaint and is getting a hearing in federal court on the argument that only a state exchange can impose taxes. Thank you for your time.
Thank you. Senator Patrick will tell us who we'll hear from now. I think we've got time for 4 more people to testify.
Okay, we have Tony Lawson, David Walton, Sheila Ford, and Corey Suber.
Tony Lawson, if you'd please step to the podium. Okay, thank you very much, Tony. So who was,
Okay, then we'll go to Janice McGeehan.
so Janice would be fourth. Who was second? Okay, so what's the name? David Walton, if you'd take the podium, please.
Good afternoon, Chairman Tibbs and Senators. I stand. Better?
That's much better.
Okay.
Thank you.
I stand before you as a resident of Boise, Idaho, also the owner of a small business in Idaho. My small business, Insurers of Idaho, has been operating an exchange, private exchange in Idaho since 2005. I'm standing here today in support of a state-based exchange. In addition to operating an exchange site and website, we've had dealings with the health insurance markets in Arizona, Utah, and Washington. One of my key reasons, I think, for very much supporting the state-based exchange is seeing from dealing with insurance markets in other states just how unique Idaho is. Our laws and our regulations, our needs are very unique to Idaho, and if we end up defaulting to a federal-based exchange by not choosing a state-based exchange, we will become a much smaller piece of a larger federal pie. A state-based exchange will do so much more to preserve that Idahoans' needs are met. It's going to be much more pliable and adaptable with local control rather than federal control.
Mr. Walton, I apologize for interrupting you, but could you tell us who you represent, if anyone other than yourself?
My company, Insurers of Idaho.
What's the name of the company?
Insurers of Idaho. We run a
Insurers of
private
Idaho.
exchange
Okay.
website.
Thank you. David Walton.
And it's Watton, W-A-T-T-O-N, David Watton.
Thank you.
And that's really all I have. I'll stand for questions.
Thank you very much, Mr. Watton. Do we have questions for Mr. Watton? Okay. Thank you very much. Appreciate that. Sheila Ford.
Thank you.
Would you pull that microphone right down there in front of your mouth? Thank you very much. And then speak loudly.
Thank you,
please.
Chairman and members of the committee. My name is Sheila Ford, and I represent myself and my family. It's a shame in the United States of America, and especially in Idaho, for your first thought in the morning to be, what do I have to do today to keep my government from doing something to me? You'll remember Mr. Hensley said Tuesday that Idaho expects from the federal government $20 million to fund an exchange here. Where will the $20 million come from? It is astonishing that a state house full of people elected to make wise decisions expect a federal government that borrows 42 cents on every dollar it spends on the things it is presently doing has $20 million to send to Idaho. Knowing the extent of the current borrowing and at the time they are supposed to be finding things to cut, Congress commits to provide these millions and billions for yet another new program more massive than any before it. As all of this exponentially expanding debt will certainly be paid by countless future generations who will not have the opportunity to vote whether they want to pay for our foolish overspending, taking this money or participating in any way in exchanges makes Idaho a party to taxation without representation. And that is unconstitutional regardless of the Supreme Court defining the individual mandate as a tax. Because exchanges, either federal or state, are the foundation upon which the ACA stands, all states that refuse to participate are doing their best to ensure that they don't cause more enormous debt payments to be confiscated right out of our children and grandchildren's paychecks. Whether we want this program or not, whether or not we think it's needed, we must stop spending money we don't have. We should have stopped long ago, if not now, when. Congress is not going to stop spending. The states are going to have to tell them, we won't take any more borrowed money. Thank you.
Thank you very much. Are there questions for Ms. Ford? Apparently not. Thank you very much. We'll next hear from Corey Serber.
Good afternoon, Mr. Chairman and distinguished committee members. My name is Corey Serber, and I stand in support of Senate Bill 1042.
And Corey,
I'm a
who-
20-year
who do you
employee
rep-
of,
oh, sorry,
yes,
thank you.
getting there.
Thank you.
I am a 20-year employee of St. Alphonsus Health System, who I am representing today. Currently serve as Director of Community Health Initiatives. St. Alphonsus Health System is based here in Boise with over 4,800 employees and over 1,100 medical staff providers. Beginning back in the late 1800s, the Sisters of the Holy Cross and the Sisters of Mercy came to the Treasure Valley and established healthcare services here. They then began a 120-year legacy of responding locally to changing community needs, operating a nursing school until nursing education was taken on by the universities, providing desperately needed mental health services, and becoming a national leader in providing refugee health programs. To keep our fingers on the pulse of changing community needs and to adapt our community programming, we do periodic community needs assessments every 3 years. And over the past several assessments, which I have helped to conduct, a common theme of need has persisted: access to affordable health care coverage. Multiple studies demonstrate 2 factors help improve health the most. Number 1 is access to a health care provider for ongoing primary care, and number 2 is having health care coverage. These 2 factors impact health so much because timely access to appropriate and needed care, from wellness and prevention to chronic disease management, decrease higher cost downstream ER visits and hospitalization. Having coverage and timely access to the right kind of care keeps people from living sicker and dying younger. Along comes a health insurance exchange, which is an insurance marketplace tool required by federal law to help individuals and small businesses shop for and obtain coverage that will help facilitate their access to primary care and their ability to receive the right kind of care to improve health and reduce costs for them and our state as a whole. The decision before the legislature is whether such an exchange should be developed and operated locally in the state of Idaho or be deferred to a one-size-fits-all federal approach. We believe that local control and accountability through a state-run exchange will result in a less expensive, more flexible mechanism to get uninsured citizens and small businesses into affordable coverage and stay nimble and responsive to the ever-changing needs in our state. We believe our State Department of Insurance is better suited to handle plan management functions and enforce our insurance regulations. We also believe that a state exchange would provide more opportunity for local innovative partnerships to improve quality and reduce costs, such as our current pilot projects with local businesses and insurers. Following the honorable example provided by the sisters in responding locally to meet community needs, St. Alphonsus strongly supports the development of a state-run health insurance exchange. It is through proactive local response that we can best meet the needs of our state and avoid unnecessary cost increases and loss of control that would occur if we default to a federal exchange. With that, I'll end my testimony and stand for questions.
Thank you very much, Ms. Serber. Are there questions? Senator Schmidt.
Thank you, Mr. Chairman. Just a point of clarification, Ms. Serber, I think you described the Idaho government as nimble.
Would you care to defend that statement, Ms. Serber?
Mr. Chairman, I would put that forward as an opportunity.
Thank you. Further questions from Ms. Serber? Thank you very much. Last, we'll hear from former Representative Janice McGeehan. Welcome to the committee, Representative.
Thank you, Mr. Chairman and members of the committee. It's great to be back amongst my friends after we don't always agree on issues, but we spend a lot of time cultivating friendships. Today I'm Janice McGeehan, and I'm here today representing myself as a small business owner. My husband and I now own and operate 3 small businesses in the state of Idaho, and I am opposed to the creation of a state exchange. I'm also opposed to a federal exchange, but I appreciate the opportunity to come before you today and express why the concerns that I have, how they will affect my business. And that's the one thing that this Capitol has always represented to me, is that ability. And I'm very thankful that I retain that ability. So I was invited to come to the Capitol yesterday to speak with some of my former colleagues in the House with their new freshman class. And the question that came across yesterday in our committee, and I've heard that before too, is why should we not move forward in assisting with establishing an exchange? And so I thought about that overnight, and the best answer that I could come up with is we should move forward in establishing an exchange as long as we know all of the answers that are to the questions that are in our minds. And Mr. Chairman, if I may request permission to read from some of the Federal Register, some of the requirements under the exchange that cause me concern.
Sure, you can read.
Thank you, Mr. Chairman. Now, don't worry, I'm not going to go into great extensive detail on this, but this is a set of regulations that was established just for the establishment of the exchange. And I'm just wanting to pose some questions to you to please, if you do consider moving forward with an exchange, that you do so with the full knowledge of what the requirements of the exchange are. And the first concern that I have in the establishment of the exchange, it says in Code 155.110, to the extent that an exchange establishes such agreements, the exchange remains responsible for ensuring that all federal requirements related to contracted functions are met. So it says right there that the exchange is responsible for ensuring all federal requirements of the law. Another concern in the establishment of the exchange is that the exchange must not establish rules. This was already referred to earlier. The exchange must not establish rules that conflict with or prevent the application of regulations promulgated by HHS. And then it goes on to say that nothing in this section of rule shall be construed to preempt any state law that does not prevent the application of the provisions of the Affordable Care Act. What exactly, I ask you all this question, what exactly does that mean? How do we read that question? And I think that's a fair question as it applies to any of our existing laws. Boy, I sure didn't get to talk about all that I wanted to talk about. Mr. Chairman, one thing that I'd be happy to answer, I think some legitimate concerns have been raised about the lack of legislative oversight. And Senator Durst, I read your comment on the blog the other day, and there is a way that we can provide, if you choose to move forward in this direction.
Representative McGeehan,
there is a
ask you to
chance.
wrap up quickly, please.
Okay.
Thank you. Other questions for Representative McGeehan? Thank you very much. Appreciate
Thank you.
it. Senator Patrick, excuse me.
Thank you, Mr. Chairman. I can't let my friend get by this easy. Did I understand you right to say we are going to have an exchange, that there isn't an option just to say no?
Representative McGeehan.
Mr. Chairman and Senator Patrick, the law does say that the states may establish an exchange of their own. It has to abide by all these rules and regs, and ignorance of the law, the rules that are written as they are today is not a defendable, it would be a laughable defense in the case of a lawsuit. We have to, if we're going to create a state exchange, we have to abide by all these laws. And if we don't, the feds will come in. And I just haven't found much distinction between the two.
Thank you. That was my question.
All right. Thank you very much. That concludes the public testimony. We'll have Mr. Hensley wrap up in just a moment, but I want to remind everyone, if you brought written testimony today after the meeting, you're welcome to come up and leave it in the basket. And Mr. Hensley, we'd now, if you'd step to the podium, we'll allow you a chance to wrap up.
Mr. Chairman, members of the committee, again, David Hensley from the Governor's Office. Thank you, first and foremost, for having this forum for this discussion. Second, some broad themes have emerged over the past few days of testimony that I'd like to briefly revisit and discuss with you. First of all, the uncertainty. You've heard a lot about the uncertainty in the process, the uncertainty at the federal level. So let's talk about what we know. We know there will be an exchange in the state of Idaho. We know our options are a federal exchange, a state-based exchange, or a hybrid. We know there's $20 million of federal grant money available to build that exchange. We know that there are further federal grant monies available to assist in the completion of that. and that there's a deadline of December 31st, 2014 for those grants. We know that the feds have proposed their path forward on how to fund the ongoing costs of a federal exchange. In the federal regs, they talk about a 3.5% premium tax on all the policies that would be sold through a federal exchange. And I think we also know that there's still going to be a market for insurance outside of the exchange. We know that businesses and individuals will be able to voluntarily take advantage of this exchange to shop, compare, and purchase health insurance. You've heard a lot about a lack of legislative oversight. I think that ignores a very simple fact. You always have the ability to legislate to address any issue that comes up in the course of implementing this exchange, or if the exchange does something that's inconsistent with the policies of the state of Idaho. I want to briefly touch on the Utah issue that's currently in play. Governor Otter talked to Governor Herbert a day ago. In that conversation, Governor Herbert relayed to Governor Otter that he has a meeting in 10 days with the Secretary, again, to discuss the option that Utah has selected, which is to continue its H Street exchange, which is for small businesses. Utah's made the policy decision not to continue with an individual exchange and will allow the federal government to operate that. I want you to be aware of the fact that, again, Governor Herbert's going to sit down with the Secretary and discuss that. And as they move forward, we're interested in hearing how that develops. You've heard that Senate Bill 1042 violates Idaho law. I've asked the Attorney General for an opinion. They provided a response, which I've provided to you, and their conclusion was that the bill does not violate the Idaho Health Freedom Act. You've heard a lot of opposition to Obamacare, and I want to remind you what the governor said in his State of the State. And I quote, "You all know how I feel about Obamacare. I will continue to encourage and support efforts by our Idaho congressional delegation and many others to repeal and replace the law. But the fact remains that for now and for the foreseeable future, it is the law. And as responsible elected officials, we're sworn to uphold the rule of law, not just those that we support. So I urge you to look beyond the important work of changing a misguided federal law to the essential task at hand for those of us in the chamber today, preserving for Idaho citizens the option of having a voice in one element of the law as it's implemented." With that, Mr. Chairman, I'd certainly be happy to stand for any questions.
Thank you, Mr. Hensley. Are there questions for Mr. Hensley? Senator Durst.
Mr. Chairman, Mr. Hensley, you mentioned that there's, in respect to the oversight issue, you mentioned that we can come in and change anything whenever we'd like to, but my reading of the bill says specifically that the bylaws written by the board will be written by the board, and my understanding is that the legislature doesn't have the right to approve those like we do other administrative rules. Am I misreading that legislation?
Mr. Hensley.
Senator, Mr. Chairman and Senator, I would provide a brief explanation. The legislation calls for the approval of those bylaws by the Director of the Department of Insurance, who oversees the entire insurance industry, as well as any change. So there is some oversight as to the bylaws. I would submit to you that if you see something in the course of the implementation of this exchange that you choose to address, you're always free to do so.
Mr. Chairman.
Senator Durst, follow-up.
Follow-up, Mr. Chairman. If I understand your answer the right way, Mr. Hensley, what I heard you say is that the bylaws can be reviewed by the Department of Insurance, which is still in the executive branch. My question specifically is, what role does the legislative branch have in reviewing bylaws, much like we have right now in reviewing administrative rules?
Mr. Hensley.
Mr. Chairman, Senator, one of the clarifications that I think is important to understand is that as an independent body, corporate and politic, we provide flexibility for this entity. We provide flexibility like we do for other independent bodies, like the insurance fund and some of those other entities. The oversight that we provided in this bill was to make sure that they have flexibility and they operate as much as a business as they can. And that was the oversight in terms of the bylaws that we felt were important. We've provided other oversight in terms of, again, Senate confirmation and other things that are going to help give you a voice in that process. If you're asking me specifically if the legislature gets to approve or deny those bylaws, the answer is no.
Senator Durst.
Mr. Chairman, one last follow-up, if I could, please.
Go ahead.
Mr. Hensley, my other question is thinking about the Senate confirmations, as you were just referring to. This legislation in the final section has an emergency enactment clause. Making the broad assumption that this were to pass both chambers and be signed by the governor, is it the intent of the governor, to your knowledge, to appoint those members prior to sine die of this session, or is it the intent to make recess appointments, thereby preventing Senate confirmation until next session?
Mr. Hensley.
Mr. Chairman, Senator, it's our hope to make those appointments while you're still here.
Further questions for Mr. Hensley? Senator Lakey.
Mr. Chairman, thank you. One quick question, Mr. Hensley. It was raised earlier about the use of cost in discussions, whether it was the $4 per member per month or the $7. And I believe you previously stated that the ongoing cost was either the $10 million roughly for the state or the $28 million roughly for the federal projections. Which figure, the 4 or the 7, did you use in that calculation?
Mr. Hensley.
Mr. Chairman, Senator, I'd like to go back and provide some context. The number I provided of 177,000 people was based on the number of individuals and small businesses insured in 2011. That was the starting point, the number of people. We know that in the process of determining the federal costs ongoing for the exchange, we know that they would propose to apply a 3.5% premium tax on policies purchased within the federal exchange. We know that the average policy for individuals in those small businesses is roughly $4,650 a year. That got us to the $28 million estimate. I think it's important to point out that if the assumption of 177,000 people participating in an exchange, we know that the estimate for the ongoing cost to run a state-based exchange is $10 million. So if we have the same number of people and we believe the cost on an ongoing basis is $10 million a year, that's how we got to the $4.80. Now, could that be more? Could that be less? I'm sure it depends on the number of people participating in that exchange.
Further questions for Mr. Hensley? Apparently there are none. Thank you very much, Mr. Hensley.
Thank you, Mr. Chairman.
The committee, Senate Bill 1042 is properly before the committee. Senator Cameron.
Mr. Chairman. Mr. Chairman, I would move that we send Senate Bill 1042 to the floor with a due pass recommendation.
Have a motion. Do we have a second? Second, a motion was made by Senator Cameron, second by Senator Guthrie, that Senate Bill 1042 be sent to the floor with a due pass recommendation. Is there discussion on the motion?
Mr. Chairman.
What does due pass mean?
Okay, let's maintain some order, but this would be to send this bill to the floor of the Senate with a due pass recommendation, which essentially means that it would pass the committee. That's the discussion that we'll be having. Excuse me, sir. The committee will deliberate now and take a vote. Senator Durst.
Mr. Chairman, I'm struggling with this motion. I think that, I personally support a state-run exchange. I support the vast majority of the components of the federal health care law. But I'm really worried about the vehicle that's in Senate Bill 1042. I really believe that we're, as senators, in approving this legislation, we're advocating our responsibility of oversight, of appropriation. I think that those are accurate statements.
Maintain some decorum, please, in the committee.
But I also believe this is an issue that the full Senate needs to address. And so I'd prefer a motion, and I'm not going to make a substitute motion, but my preferred motion would be that we move that this have no recommendation. I hope that we have the opportunity to really dive into what we're doing here. I think that we need to really think about the fact that we're going to let independent body start making huge decisions about healthcare policy in the state of Idaho, and if that's something we're comfortable with.
Thanks, Senator. And I just want to say we appreciate the depth of emotion and your feelings. However, the committee needs to be able to debate without interruption, please. Thank you.
Mr.
Further
Chairman.
discussion, Senator Cameron.
Mr. Chairman, I just had a few thoughts that I'd like to express and share. And I don't know. First of all, I suppose I've declared it so many times. You all know this, but probably officially for the record, in my private life, I sell health insurance along with some other products. Health insurance makes up a fairly large portion of my income, and because of that, I don't know that if you could rate opposition to Obamacare. I think I'm at the top end of that scale. I just have real strong, passionate feelings against the Affordable Care Act and the provisions and how it was passed and the constitutionality of that act. I was hopeful that the Supreme Court would overturn it. And I'm disappointed that they didn't. I feel very strongly about that. I was hopeful that we would have a change in the makeup of our elected officials in Washington, D.C., and that we could look forward to repealing all of it or most of it or many of the provisions of it. But those those options have long passed us. So then we're forced with another alternative. Now, some people would perhaps argue that we should do nothing and join with some other states. I have to tell you that in my judgment, abandoning the battlefield does not make the federal government weaker. It makes them stronger. I believe the motive of the Affordable Care Act, the underhidden motive, is to move us to a single-payer system. And I believe and I believe, this is where I will disagree with some of you in the audience, I believe that the state refusing to set up a state exchange empowers the federal government and allows the federal government to move us towards that single-payer system quicker. Now, my friend Representative McGeehan spoke to us, and her and I have had disagreements before. She's still a good friend. I see significant differences between a federal exchange and a state exchange. I see significant differences between your rights and my rights as an individual to choose what's the best health care, what's the best health insurance program available to me. I see significant differences in control. Under a federal exchange, we acquiesce all control to the federal government of our small group and our individual marketplace. That means the Department of Insurance does not have the ability to regulate, to pull into place an insurance company that's acting inappropriately. It means that if you have a consumer issue, you can't go to the Department of Insurance. You have to go to a bureaucrat in Washington, D.C. I see significant difference in the cost of running an exchange on the state level versus the federal level. I've seen it. A few years ago, the federal government decided they wanted to implement a pre-existing condition high-risk pool. The state refused because we had our own high-risk pool that was operating rather well with state decisions. They decided to do it on their own, and they did it. And it's more expensive to run it. And if it wasn't being run by the federal government and being paid for, and union membership wasn't running it as a way for that union to be able to generate funds, it wouldn't be even remotely possible. I see significant cost difference in the ability for you as consumers to be able to purchase health insurance. If you go to a federal exchange, you will end up with a nationwide carrier, a nationwide non-for-profit carrier, and maybe a few others that they choose to allow. All the state carriers, the Blue Crosses of Idaho, the Blue Shields, Regents Blue Shields, all the other carriers would have to apply. They'd have to apply to participate in the federal exchange. And if they don't meet the federal exchange's requirements, then they won't be able to participate. All of these carriers have mandates put on them by other states. Our state has wisely chosen not to participate in many of those mandates. And because of that, our costs are lower in this state. If you go to a federal nationwide exchange, those mandates will impact your cost. Those mandates will cause your rates to go up significantly more. Now, I want to talk just briefly, and I've taken longer than I intended, but you can see I feel strongly about it. Senator Durst has brought up the oversight issue. We have several entities in this state that are run just the same way. The high-risk pool was mentioned. That's one. We don't approve their budget. We don't approve their bylaws. They're working rather well, and they're serving the citizens of the state of Idaho in a very respectful way. The State Insurance Fund is another. We market workers' compensation through the State Insurance Fund. It's a quasi-public entity. We don't approve their budget. We don't, and yet, in fact, I think Senator Getty still serves on their board. We have oversight. We have the ability. Idaho Housing Authority. I was interested, my friend, former Senator Beck, spoke about it, and yet he used to chair the Idaho Housing Authority, a very entity that does the same thing that he suggested that we shouldn't do. I find that interesting at best. Mr. Chairman, I've spoke too long. I wish I had another choice. Somebody shows me another way that we can do this, I'm all ears. I don't see another choice. The only choice I see is for us to follow what I think was the lead of Governor Otter, and I think he should be commended, not criticized. He's trying to protect our rights. He's trying to protect our sovereignty. He's trying to do what he believes to be right, and I commend him for it. And I think we have this obligation to move forward. Thank you, Mr. Chairman.
Further discussion on the motion? Senator Getty.
Mr. Chairman, Senator Cameron really covered it well, but I will speak from the position of the seat on the board of the State Insurance Fund. We provide coverage for 43,000 businesses in this state. Some of those businesses that would not have coverage available any other way. It's done in a very efficient and effective manner. Rates are 9% less than those published rates that are out there for the general public. And I see no problem with it operating as a quasi-public entity very effectively.
Further discussion on the motion? Senator Lakey.
Thank you, Mr. Chairman. Senators, I know, like myself, you've received lots of input on both sides of this issue. And I feel like I at least have to make a statement. I despise Obamacare, and I think, well, that's actually an understatement, not a statement. I hate the federal mandate. I don't like the way it was pushed through, that let's pass it so we can find out what's in it. I think it's a bad policy and a bad decision. I don't think that the federal government can do little, well, they can do little if anything, cheaper or better or more efficiently than the state government or the private sector. So I'm frustrated with the position that we find ourselves in. I don't like the fact that the rules keep changing and that continuing to come out. But I have to look at it as the reality of the way it stands now. I don't believe that if we don't do a state exchange that the federal government will not be able to make it happen. I think the reality is we're faced with a federal government exchange if we don't do something different. We lost in Congress. We lost in the Supreme Court. In my opinion, the law is unconstitutional. I agree with Justice Scalia, not Justice Roberts. But in our form of government, the highest court in the land, the Supreme Court, has made that ruling and that determination that it's constitutional. And we lost the presidential election. All those things surprised and severely disappointed me. I think, again, the current reality we're facing is either the federal government exchange, which is the worst option, the state government exchange, which I think is a better option, but still a government entity. And I think the governor's proposal at least has some potential. inserting some free market principles in the legislation. There's no mandate to participate. There's no mandate on providers. And if we find that there is no difference in our proposal, we have the ability to do something different as a legislature. For me, it's coming. I can't stand there and let the federal government do it to us. I feel obligated to try to exercise some discretion at the state level. I think we do continue to fight at the federal level, and we pursue any viable legal options. And if there's a positive change, we can affect that at the state. But that's where I'm coming from, Mr. Chairman.
Further discussion on the motion. Senator Schmidt.
Mr. Chairman, thank you very much. And I would like to respond. And I hear a lot of acquiescence and reluctance. And I'm going to say this is an opportunity. And I'm sorry, we have problems with health care in this country. We have problems with health care in this state. Having discussions, having open and honest discussions about these problems are what we need to do. We've done that here for 2 days. There is still disagreement. There will be moving forward. But we will not solve these problems if we do not discuss them and move forward. So I see this as an opportunity, and I will support this motion, and we will discuss it on the floor of the Senate, and we will probably come back and have to fix things.
Further discussion on the motion. Senator Patrick.
Thank you, Mr. Chairman. I also feel strongly about this bill, or I wouldn't be speaking. I don't like the federal policy that we have to have insurance, and it has to be done in a manner that they choose. But I guess I'm afraid, I'm too conservative to allow the federal government to run an exchange. I think the best option, the most conservative option, is to do our own, try to do the best we can with it, and try to avoid as much federal oversight as we can. And I don't think we have any other options, not in my mind.
Do we have any further discussion on the motion? Hearing none, the motion is that Senate Bill 1042 be sent to the floor with a due pass recommendation. The Secretary will call the roll. Let's see, we had a motion by Senator Cameron, and the second was by Senator Guthrie. Is that correct?
Senator Patrick? Aye. Senator Cameron? Aye. Senator Getty? Aye. Senator Guthrie? Aye. Senator Martin? Aye. Senator Lakey? Aye. Senator Schmidt? Aye. Senator Durst? Chairman Tippett?
Aye. Roll call shows 8 ayes, 1 nay. Motion is carried, and Senate Bill 1042 will go to the floor with the due pass recommendation. There being no further business to come before the committee is adjourned.